evening, everyone. Before we get started, I'm going to read the disclaimer that you see on your screen. The Pharmacist Virtual Learning Experience is brought to you by Mandell's Clinical Pharmacy. It's intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse, and it is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandell's Clinical Pharmacy according to the prescription as written by the provider. Thank you, everyone, for tuning in to the Pharmacist Virtual Learning Experience. This is the first online live pharmacy medication instructional program brought to you by Mandell's Clinical Pharmacy. This educational program brings you together with outstanding healthcare professionals right from the comfort of your own home. I'll be your host tonight, Tony Newman. I've been a nurse for over 10 years in the New Orleans area, with my last in the fertility world. Pharmacist takes place every Monday at 7 p.m. Eastern. Tonight, we will have a live medication instructional program on 3 fertility products: human growth hormone, the Gonal F multi-dose vial, and Hcg, including an interactive Q&A throughout the program. So join us on Zoom or Facebook Live, and we invite you to be part of this discussion by sharing your questions in either format. Every week, we are joined by a different healthcare professional from across the nation to provide you with real-world experience, just as if you were sitting across from them at your clinic. Tonight, we are joined by Wanda Hofgesang. Thank you again for your time and interest this evening, and now I want to turn it over to you, Wanda.
Good evening, Tony. Thanks for that wonderful introduction. And hi, everyone. My name is Wanda Hofgesang, as Tony introduced me. I've been a part of the Mandell's Clinical Pharmacy virtual learning experience for almost over a year now, and it's been a wonderful opportunity to be able to share the teaching component of the fertility medications with patients. So hopefully, we hope you're in for a treat to be able to see some of the medications and also then have a live question and answer session after, so that any questions that you might have, we would like to entertain and help you walk through. I am a nurse presently as well, like Tony, in the field of infertility and reproductive medicine. I've been a nurse for 27 years with fertility over 20 years. So lots of teaching has been in my background. And so I know how important the teaching aspect is when it comes to the medications and patients needing to feel comfortable with everything. So really what we want you to sit back and enjoy is taking a look at our highlighted medications tonight, which Tony mentioned are the human growth hormone, or HGH for short, the Gonal F multi-dose vial, and then the HCG, which is human chorionic gonadotropin. There's always a lot of acronyms in fertility, so it's hard. So be patient with yourself because it's a mouthful, we know. With that being said, what I would also mention is that any questions that you might ask during the live Q&A, just keep them focused on general questions, anything that might be specific to dosage or your protocol. Really, we need to refer you back to your healthcare provider and your clinic and your nursing and doctor team for that, because they are the ones that are helping guide you through your specific cycle. But we're looking to give you some nice general information about each of the products. So just know that when we get to the question and answer session. As well as Tony stated, all of the videos that you'll see this evening are on the My Mandell's Pharmacist website, also on YouTube and Facebook Live that you're seeing as well. The live events are also there. So you don't have to feel like you have to take everything in tonight. You can always go to that virtual learning library and be able to take a look at a previously recorded video. And if that helps you too, some of the medications that we do tonight may not be a part of your cycle, but there may be others on that library that would be great to go in and look at if they are something that you need to take a peek at and learn a little bit more about the injection and the mixing technique, etc. So one of the things we'll do to get started before I have Tony put on the first video is, big thing is to organize, I think, your items that you receive from the pharmacy. Sometimes you get a very big box and you're kind of afraid of it, so you don't want to open it and you may put it to the side. It's really important to treat it like you would any box that you would get from dropped off at your home. Open it up, take a look, organize the items, put like items together, because you may have multiple dosages of different products, and not all of these products are necessarily done at the same time. But I think getting organized is probably one of the best things you can do. The other thing is that each of the medications will have potentially a storage recommendation on there. So you might know if something needs to stay stored in the refrigerator before and during usage, or if you need to keep it at room temperature. So really opening up that box is real helpful to do so. And you always have the pharmacy that sent you your products, like Mandell's, always as a resource to contact them if there's something that seems unusual to you and you're just not sure, or even you call your clinics as well and we try to troubleshoot that. We all collaborate together on your behalf to help and assist with these medications once they're sent out and they arrive at your home. So our first medication that we are going to showcase is going to be the HGH, the human growth hormone. And just so you know a little bit, HGH is one of these products that may be a part of your cycle. It's not for every patient. It's usually appropriately recommended for selected cycles. So your doctor is going to look at your age, diagnosis, and history to determine if you need the HGH. And so if you do, what we want you to be able to see tonight with the video is how to properly store, administer, and mix that medication. So Tony, we can get to that video and then we'll come back for some live question and answer session. Hi everyone, the following video for your medication experience through my Mandell's virtual learning experience is for human growth hormone. Human growth hormone will be possibly a part of your fertility cycle. Your clinic will determine for you based on your previous gynecological history, or if you've done any other cycles of fertility treatments, if this is a part of your cycle. It works in conjunction with some of the other medications that may be a part of your cycle. So it's not a one-size-fits-all that everyone does human growth hormone, but it absolutely could be a part of your cycle. So the purpose of this video is to help show you how to mix and administer human growth hormone. When you work with your fertility clinic, they will, of course, be working with a pharmacy like Mandell's that'll be shipping you the medication. Human growth hormone might come under another name, such as Omnitrope is another one of the names that you might see this in the packaging when you receive it. As always, there will be instructions on how to store the medication. Usually once you receive this medication, you can store it at room temperature. It is a mixing medication, so you'll find that I'll mention that once you mix the product, you'll have a little remaining of that mixture to use for a following injection, and that part of the mixture, we will remind you to put that in the refrigerator. So there will always be where you'll be guided how to mix, how to administer, and what dosage you're taking. All of that specifics comes from your clinic. This is just a nice general video to help you along once you do get that medication and you're ready to get started. What you'll find when you get the medication, the supplies you'll be needing are, usually you'll have 2 vials. One will contain a powder or a pellet in the bottom of that vial. The other vial that you'll have will have what looks like sterile water, just a water solution, but it is a sterile water solution. So these 2 vials are what you'll need in order to do your mixing. You may receive multiple vials from the pharmacy, and that's determined by your clinic. Depending upon how many days they project that you'll need the medication and your daily dosage, you will be ordered the amount of product that you need. And certainly if you ever need to get more, the clinic will advise you how to contact the pharmacy to potentially get a refill of that. So you need your powder vial and your water vial. As far as syringes go, what will be sent to you is you might have this 3 cc, 3 milliliter syringe sent to you, and it may have a longer needle on that. This is typically the mixing needle that you'll be using for the HGH or human growth hormone. The other needle and syringe that you might also receive may have an orange cap to it. These are typically referred to as insulin syringes because there's a very small measuring thin barrel needle, barrel syringe. And so what you'll find is you're taking a very small amount of liquid amount of the medication. And so you'll need this type of syringe in order to inject. HGH is what we call subcutaneous injection. So the needle that you'll be using for injecting is going to be rather tiny, usually a 1/2 inch in length. And the area of location will be confirmed to inject, but oftentimes at most clinics for this type of shot, you'll be using either the lower belly or possibly the upper top, upper side, outer thigh area. These areas have some nice fatty tissue, and that's the type of injection this is for absorption that works best with the medication. So your first step with any mixing and part of this mixing with your medication step is it's always a good idea to wash your hands. Working with the medication isn't sterile technique, but it certainly is a nice clean technique. So washing your hands before you do the mixing is a great way to get started. The next step is have available, and you might get these from the pharmacy. These are little alcohol pads, but you may also have a bottle of rubbing alcohol and a cotton ball that can be used to help administer when you put this into the skin, or also you'll see that I use it on top of the vial when before I put the needle into the vial. So I'm taking one of these and opening it up. And my next step is going to be to uncap each of the vials, and I'll hear a little snap with that. And after I hear the little snap and I've taken the cap off, I'll just rub the top a little bit with alcohol. Just in case I did not wash my hands, it's a good idea you're cleaning the top of that vial. Even though usually it's sterile under the top, it's just a good extra measure to take to reassure that everything is good to go. The first syringe that we are going to use is that syringe that has the longer needle. Remember, for the HGH, this is a mixing needle, so I don't want you to worry about the size of that needle and syringe. So you open that up. Sometimes it's not a bad idea to just make sure that that needle is secured nicely, because it can come off that syringe. So you want to turn it and just make sure it's secured nicely onto the syringe. And we are typically going to be advised by the clinic how much liquid to draw up, but oftentimes with the HGH, what you'll be drawing up is 1 ml, 1 cc of liquid using this syringe. So I'll draw up to the 1 ml. So what I do with that is I'm drawing up an ml of air. I'm going to pull the cap off, take the vial that contains the water, the sterile water, and I'm just going to raise this so you can see me, but you could keep it on a nice flat surface. Put that needle in all the way through the rubber stopper, the center, turn it upside down, and you can inject a little bit of that air into the vial. If you forget this step, it's perfectly okay. I'm just equalizing any pressure in that vial by doing that little step. And then my next step is to just draw down. There may be some smaller bubbles there. That is perfectly okay. We are just mixing, we're not injecting. So right now, bubbles are not an issue for us. But we're going to draw down, lining up that black rim of the plunger to the 1 line. So 1 ml. I might have some extra solution in here. If our clinic tells us to only draw up 1 ml and there's extra, you don't need the extra. You can discard that vial. And then you take that 1 ml and you're going to put that into the vial that contains the powder solution. Let that powder dissolve. It may be very cloudy at first, might be even a little bubble in there. Again, you can keep the needle in there and gently roll. You'll see where mine's a little cloudy here, and that's okay because it's mixing the liquid with that powder. So we let it do its mixing. After it does the mixing, we're going to remove that needle because that was just our mixing needle. We can then put this into our red sharps container. Oftentimes, like Mandell's Pharmacy, they will provide you with a sharps container to keep all your biohazards in. That's anything that's sharp. So we can put that safely in the biohazard container. Now, this one vial, often with HGH, will contain 2 injections. So if you are given 4 vials of medication with 4 vials of water, then just to break that down mathematically, you have 8 injections. If you're given 5 vials, there's 10 injections. If you're given 3 vials, there's 6. Again, the dosages that you need for your cycle will be determined by your healthcare clinic, and they will be able to order for you what you need. So once this has been mixed, I'm now going to use the injection needle and syringe to draw up my dose with my clinic's help and my nurse and my doctor's guidance with my dosage. So for the sake of today's demonstration, what you'll see here is this syringe is measured in units, and there's 100 units in the capacity of this syringe. What I'm going to have you draw up today is 50 units. That may very well be a very similar dosage that you might have that we'll be advising you to take with your medications. So we have you uncap that needle. Here you don't have to draw up any air. It's perfectly okay with this little needle to just go in through that vial once, okay? And you're going to draw up and pull down to that number 50. And even though that might look like you're drawing up a lot of medication, I just want you to know that with this syringe, even though it looks like a lot, it really is not, because the needle, or I should say the syringe, is rather thin. So it's not a lot of liquid amount that you're taking. So I'm drawing up to the 50 units. If your clinic tells you to take 54 units or whatever that may be, they'll advise you specifically, but this is around the range that you might be advised to take. There will still be medication in this syringe, in this vial. So what you will do is, this is the vial that you would now put into the refrigerator. And then when you take this medication again tomorrow night, you wouldn't have to do the mixing step. You'd be able to simply use your orange tip needle to draw up. So one bottle usually will make 2 dosages of the HGH for you. And so really you're not mixing every night, which is a bonus, but you're mixing one night for 2 doses, and then you'll mix again another vial, because you will usually be on this medication for, an average of anywhere from 6 nights to maybe 8 nights. So that's why you're going to have anywhere between 3 to 4 vials of the Omnitrope or HGH medication. So once that liquid amount is in your insulin syringe, now you're ready to do the injection. I've capped the needle just to keep it safe, so I can put this down for a minute, just to be able to show you guys where the injection areas are that you're going to use. I have a little mannequin here to just show us. It's easier for you guys to see that it's the lower belly below the belly button. And if you have your hip bones where you can feel that, in between those hip bones is where you want to keep the injection. And in this little area here, this is where we sometimes have a little fatty tissue that we're able to pinch. Upper abs tend to have some muscle there, so this is not a muscle shot. It only needs to be going into that area of fatty tissue. Your clinic may also advise you that you can use the thighs as another area. And so if you're using the thigh area, what we're focusing on here is upper thighs where there's not as much muscle, upper thigh area, and you could even use the side outer thigh area. So upper top thigh, upper side outer thigh, or belly. You can choose with this injection to be laying down and have somebody give you the shot. If they are administering the shot to you, the angle of the needle is going to go straight in. So if I were giving a shot to someone in their belly, I put the needle straight in this way. In the thigh, I go straight in this way if I'm at the top of the thigh. And if I'm doing the outer thigh, I go straight into their outer thigh this way. Okay, so it's a 90-degree angle, technically just straight in to make sure you get it into that fatty tissue. If you were to give yourself your own injection, you could sit as I am sitting in the chair, and the angle would be that I'm putting that needle straight into my belly. So I'd be giving the needle straight in this way into my belly. And if I'm doing my thighs are sitting, as this way with my belly up here. Once again, I'm going straight into the thigh and straight into that side outer thigh. The reason you just want that angle is just so you make sure that you get that into the area that you need to give that injection. One other thing that you do with this injection is, because it's fatty tissue, you want to give a little pinch. So I kind of show my arm here just to see that this is my fatty tissue. So I gently want to lift the fat on the belly or the leg and lift it up. I don't have to squeeze very hard because you could bruise with that. So it's just a gentle lift. That's how you prepare the injection area, is a gentle lift. You've got the angle. These are the areas that you can select from, and then you determine who might be giving the shot, if you're having the shot given to you, or if you'd like to self-inject. Today, what I'll just demonstrate to make it a little easier for the video is that I'll show you if you were giving your own injection in the belly. So what we would do is we select the area of the belly first that we're going to give it into, and we clean that area with a little cotton ball doused in alcohol. Our next little step would be to pinch that area. So hopefully, I want to just turn it slightly for you to see this. If I pinch that area of fat, I'm giving a little gentle pinch. I would then uncap the needle. And with that little pinch, what I do is I place the needle gently to the skin, 90 degree. I put the needle in. This is where I might feel a little mosquito bite pinch. That's very natural and normal to feel that. but it's very gentle, that little teeny pinch. Once that needle is in the skin, I let go of the fat, and then I just simply push on the plunger, and I don't have to go too fast or too slow. I just go in a nice steady motion in. And then once all of that is into the body, in the skin, I then gently pull that needle straight in, straight out. Put a little pressure there. And that will be where we just have a little droplet of blood. Or what you might find is the medicine tries to make its way back out. So you want to keep it into the body there. So you just give it a nice little gentle pressure. Okay. And this would be your injection of the HGH. Once you are done with that syringe that you've just given a shot, you can leave the cap off and then put this gently right into your biohazard container to keep yourself and anyone in your family safe from any of those sharps. And as I noted, the vial that we did mix, we're going to put that in the fridge for tomorrow evening. Before we give the shot, we can take it out and set it down on the counter for about 5 minutes or so, just to let it warm up from that cold temperature. You can take it right out from the fridge, or you can let it warm up. Either way is fine. And then all you would need is one of those insulin syringes to draw up that dosage, because there'll be one dosage left, and then you'll administer the HGH. And it'll be that third night that you'll need to mix a new vial. So remember, you might be anywhere from 6 to 8 days of this, doing one injection daily. But again, the time of the dosage, how much you will take, and where you're going to inject, the clinic will also confirm this with you. But this video is a nice general way to see before you get started, or while you're beginning your cycle with this medication, how that medication is mixed and administered. So we do hope here at the Virtual Learning Experience with Mandell's Pharmacist Program that this was a helpful video for you. And from all of us here at the Virtual Learning Experience, we wish you all the very best with your fertility journey and your medication cycle. So as you can see, that's a pretty good video that was made for that product for you to see. I do always try to highlight when I do my videos to state that, it's a general overview. Always know that, the guidance for specifics to your dosage and even some of that mixing could vary slightly in how many days you may be on it, based upon your clinic, your healthcare provider, and what's best and needed for you with your cycle. But if you're a patient that is using the HGH, at least it gives you the opportunity to see that that is something that is mixed. And then sometimes you're just drawing up a dosage for a couple of days, and then you may have to mix another vial. And then we talked a little bit about the storage of that as well. But Tony, I don't know if we have any questions that are coming from anyone in regards to anything specific for the HGH.
Yes, so one of the first questions that came through on that was a really good video. It was definitely very helpful. I know it's not one of the more common meds that we use, but it is used. So it's very good to have that information. But what role does the growth hormone play in a typical fertility cycle, and how would it help me get pregnant?
So a lot of times, even in our clinic, as well as I'm sure for you, as Tony, as well, there's a lot of different medication protocols. And as I said, it really isn't with fertility a one size fits all. It really is important that the doctors are taking a look at and obtaining a clinical history. If a patient's done IVF before with success, without success, has ever been pregnant, never been pregnant, has had losses. So really for all of us, it's taking a look at all of that and coming up with, is HGH something that's needed for your cycle? And as I mentioned, it's an appropriate medication for selected cases. The main idea behind some of the HGH research has been that its goal really has been to improve the hormonal quality within the egg, or the environment inside the egg, to hopefully improve egg quality. So sometimes when we think of that at clinics, it might be best suited for a patient that potentially has diminished ovarian reserve, might be of advanced maternal age, which sometimes is considered 40 or older, maybe who has done a previous cycle with potentially an outcome of not pregnant, or maybe had some poor embryo development, something like that. So when we're looking at kind of that patient, we may be looking at some of these other factors to determine that this product may be excellent to add in for them based upon some of that clinical information. So the goal really with all of this is to obviously have pregnancy with all patients that are doing fertility, but the combination of drugs and how you do that is tailored to you based upon your individual history. And so really it's a matter of looking at if you're one of those patients that might really benefit from a little extra push in helping if there's any issue that they might think that your eggs might have a difficulty in terms of their quality, and maybe helping to try to get that quality to amp up a little bit with the HGH.
So the next question we have is, I'm traveling, how would I store this while traveling?
Yeah, good question. I was looking a little bit at some of the different products. So basically with the HGH, some of what I read too was that once it's reconstituted, if you were to happen to leave it out for no more than 24 hours, and reconstituted means it was mixed. So as you saw, after I mixed it, if I left it on the counter for up to 24 hours and then realized, oh my goodness, I didn't put it in the fridge, I have that little window and I can put it in the refrigerator. So if I'm traveling with it and I realize that, you want to kind of think of it like packing something, like you were packing a lunch bag, etc. Just put some ice packs into a cooler bag and you can put the bottle in there. You don't want to have it, you might want to put it in, just wrapped, in a little something, maybe a paper towel or whatever, just so it doesn't get wet or what have you. But the idea is that you want it cooled when it's been reconstituted or actually mixed. I believe if it's not mixed, what I've seen is that it could be a product that can stay out up to 72 hours. So even if you received your package and you haven't mixed it yet and it's been a day or two, you can then put it in the fridge and keep it there. So refrigeration is never going to hurt it. So if you store it there the whole time, that's fine. But definitely if you're traveling with it and you have mixed it, or you're traveling and going somewhere, and when it's during these humid months still that we have lingering, even up here in the Northeast in October, just want you to know that definitely putting it into a lunch bag with an ice pack is probably the best way to carry that, storing it in a car trip or etc.
Okay. And I think we've kind of talked about human growth hormone not being like the traditional treatment, but the next question kind of plays into that a little bit more. Is it a normal part of treatment, or is it a more controversial medication?
It has, sometimes when you have medications that are used for a variety of reasons, like human growth hormone, it's not the only indication is fertility. It can sometimes, I guess, be considered controversial, but there has been some research done with it with fertility cycles. There has been some studies. And so that's what we have to, we learn through experience with the product, which is important. So some of that research and that, studies have alluded to that it might be of benefit to the category, as I said, of diminished ovarian reserve or 40 or older, or somebody that you might have that egg quality issue, and you really want to give them the best chance in getting a couple nice eggs from an IVF egg retrieval. So not necessarily that it's harmful to you, it's just that if you don't need something, then we're not going to prescribe HGH. Human growth hormone is not across the board for everybody, because if I don't really need it because I don't fit in a category that really shows that it might benefit, then I might just do fine without it and have a very nice stimulation. This is sometimes really for that, maybe a difficult responder or things like that, that would be helpful. So it's something we can consider using.
Okay. That's about all the questions we have on the growth hormone. So if anybody thinks of anything, wants to add it, feel free to type it in the chat box. We can go ahead and move on to the Gonal F multi-dose file if you want to kind of introduce that. And when you're ready, I'll go ahead and set it up. Absolutely.
So it's kind of good that I did already show the human growth hormone, because similar to that, the human growth hormone, the Gonal F multi-dose vial is a vial of powder, and you mix some liquid into it. So we're similar, we saw that in the previous video. And then it is what we call a subcutaneous injection. It's a little injection that goes in the belly or the areas that I showed as well on the mannequin, which is in the upper thigh, outer thigh. So there's some similarities in fertility drugs, which is kind of nice, because once you learn one aspect, it might carry you through to other products. But with the multi-dose Gonal F, that product is now considered FSH, which is follicle stimulating hormone. And all women in all fertility cycles, when we're looking to stimulate those ovaries to produce potentially multiple follicles, multiple eggs, that's what you're using is extra FSH. We have this hormone naturally, but usually our bodies respond by developing one mature egg. When you take this product externally via a shot, you're administering more, it's circulating a little more in your system. And the goal is that you'll have multiple eggs, the potential for multiple eggs to develop. So that's really the goal of that FSH, follicle stimulating hormone, which is what that Gonal-f multi-dose vial is. So without further ado, we'll show that video and then come on back for some questions if you have any after you see that video as well. This video is to help you with the multi-dose Gonal-f with mixing and administration. If you've been prescribed multi-dose Gonal-f, Gonal-f is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue, so that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is one vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that one vial. Know that that's the medication, is that one vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is one pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have one Gonal-f, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than one day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, the finishing it off is this injection syringe, which is a Gonal-f 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here, for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click, and then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently, because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling, because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center, and then turn it upside down and then you inject. A little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it's occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there, and with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently, set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using 2 separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it doesn't have to be 2 shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay. So I hope that video helps you to understand the multi-dose Gonal-f product, and best of luck with you in getting started on your injection journey. So that multi-dose Gonal-f vial, as you can see, it is very similar to that HGH, where they both are powders. You mix them, and sometimes you have more than one dosage in that vial, and you refrigerate in between the usages. And also the injection technique is similar. So it's kind of nice to see that although these 2 products have different purposes within the cycle, there are often a lot of similarities. So when you've already learned how to work with one product, and say sometimes something else is added into your cycle, then you can feel a bit more comfortable because you've already worked with something very similar. So that's a benefit in products when they are similar in terms of how you mix and also draw up and inject. So Tony, I don't know if we have any questions for us with that Gonal-f multi-dose.
Sorry about that, still muted.
Oh, that's okay.
The first question we have is actually about the overfill. Someone is a little confused on how it helps save them money. So can you explain, the Gonal-f overfill again?
Perfect. With the multi-dose, and sometimes with some of the other FSH products, there is, through the manufacturer, they want to just make sure that the patient gets exactly what they dispense, but the fine print will show that there is a little overfill. And for us, when we're obtaining medications or putting through a medication order with the help through the pharmacy, what we can do is, especially with sometimes patients that might be paying for their product out of pocket, and meaning that they may not have coverage, there is a benefit in the overfill, because if you use every last drop, then you won't need to open a new vial and mix and waste some of it. So it can help with waste and help make sure that you don't have to order more vials than necessary. So that's how you're saving, because if you use every drop, not just what it states on that outer packaging, but reading the fine print, the nurses will say, your product has a little bit of overfill, this is how much. That way there, you won't discard it thinking, oh, I'm done. You'll be able to take and use every last drop, and then you might not need to purchase a refill or obtain extra vials, which cost to you, especially, like I said, sometimes for patients that do have limited coverage. And that can benefit you because then you're not having to expand upon that order and obtain more vials than you may end up using.
The next question we have is a good question. I like when people ask like why we're doing something. So how does FSH work in a normal cycle? What are some of the most common reasons my FSH would not work correctly during my IVF cycle?
Okay, so as I'll reiterate from the video, is that FSH, follicle stimulating hormone, mainly the big goal of it is just think about what you're doing in a cycle. You want to increase the number of potential eggs that you develop for either an egg retrieval, most often egg retrieval, but you could be doing maybe an injectable cycle with insemination. So we're looking to increase the number of potential mature eggs to help with our chance of ultimate pregnancy. So FSH, follicle stimulating hormone, is the key medication that's helping with that in your cycle. In terms of what could cause any issues that might be that the product isn't working or if there's any issue, I know in our clinic, if there's ever a question about someone's response, a couple things we can do. One of the things we might actually do is draw blood and we'll run an FSH from your blood. If that shows that your FSH is elevated, we know you're getting the product. We know your body is receiving it. So sometimes some people just take a little longer in a cycle too. It just may take a little bit more time than we anticipated. So we just got to give their body a chance to continue. But if there's a question about injection technique, is she getting the product? Either checking with a blood test or even just showing, and the doctors will have us make sure and demonstrate in person that the patient is comfortable and is injecting the medications properly. So injection technique would be reviewed, revisited, potentially checking the blood for FSH. The other probably thing is just seeing if you need to increase dosage. So just like at Tony's clinic and our clinic, we're monitoring and watching you very closely with your blood work and your ultrasound. So oftentimes patients ask, why do I come in so frequently? That's really why you do come in frequently in these cycles, because we want to try to do our best to keep you on the right dosage. And if we detect that you need a little more medication, a little more FSH, or a little less based on your response, that's our reason for doing that morning monitoring, blood testing, and ultrasound.
This is a good question. How many follicles can I anticipate after my treatment with GONAL-f?
Really, ideally, what you're hoping for is I know for us with IVF, for example, we're looking to hope to see average minimum number of follicles anywhere between 3 to 4 would be like our minimum to maybe take somebody to egg retrieval. But average egg retrievals can yield around 6 to 10 mature eggs. It doesn't mean some women might not get more than 10, but that can be an average. If you look at all IVF cycles and look at the numbers of eggs retrieved, generally an average might be around 6 to 10 eggs, but with a minimum hopefully that we'd like to see to get you to retrieval of anywhere between 3 to 4 follicles, 3 to 4 hopeful potential eggs.
Okay, so we'll give everyone a few more minutes if they want to add anything, ask any more questions about GONAL or any other medications that we've talked about tonight. And then our last medication that we're going to do and go over is the HCG. So if you want to go ahead and introduce that, Wanda, and I'll get the video ready.
Sure. So HCG is probably a very important product to review. It is similar to the other two that I just showed in the sense that it is a mixing where we reconstitute. That's really the word that's used. Reconstituting means you might have a powder and a water and you're mixing them to let that powder liquefy, and that powder is the medication. So HCG, like HGH and the GONAL-f multidose, same idea. The difference with HCG is it does come in some varied strengths. So you'll see that that will be something that sometimes you might find your nursing staff is working and your clinic is working with you on your dosage, your strength of that injection. But the big thing about HCG is it typically is the medication that's preparing you, and it's often called a trigger shot. We refer to that within the clinic in preparing you for procedure, whether it be with intrauterine insemination or whether it be for the vaginal egg retrieval. So the idea there is that it's usually right before procedure. It's the product that's going to induce the ovulation and prepare you for your procedure, as I said, whether it be insemination or egg retrieval. So we'll take a look at that video so you can watch the mixing and the administration. HCG can be sometimes a subcutaneous injection like the others that I've shown in the belly or the upper thigh. It also could be intramuscular. Really, your clinic will guide you with which method you're administering, but it's just important to know that there are 2 methods of administrating for that, and your clinic will guide you through your cycle. So we'll take a look at the video and come on back for some questions. Hi everyone, the following video is here to show you the mixing and administration instructions for HCG. HCG stands for human chorionic gonadotropin. Sometimes your pharmacy may have sent you a box that has the name on it Pregnil or Novarel, or it might say chorionic gonadotropin. Any one of those 3 varieties is your HCG injection. And typically this is administered to induce an ovulation. Sometimes it's called the trigger shot by your nurse or by your clinic. When you're taking this, it's to, like I said, initiate an ovulation, and you might be preparing for a procedure to follow, such as an intrauterine insemination or an IVF egg retrieval. Your clinic will review specific mixing instructions for this medication, and they will review your dosage and the method of administration. For the video today, we will demonstrate that this medication can be given either as a subcutaneous injection or it can be given as an intramuscular. If we use intramuscular, we'll demonstrate that we use the buttock muscle for that. And with the subcutaneous, I will show you that it goes in either the lower belly or upper thigh area. Some supplies that you're going to need to get started with this medication, just to give you a little list here, is going to be your box that'll have HCG on there, or Novarel Pregnil. You'll have 1 vial of HCG powder or tablet. So sometimes our lingo is, some nurses will call it a powder or a tablet. Either way, that's the same. You'll have 1 vial of sterile bacteriostatic water. You'll need a 3 milliliter syringe, 1 of those. And you will need 2 22 gauge 1.5 inch needles if you're doing intramuscular injection. If you're doing subcutaneous, you will be using 1 22 gauge 1.5 inch to mix the product, and then to inject it you will be using a smaller needle that I'll demonstrate, but is a 27 or 30 gauge 1/2 inch needle, which is the tinier, shorter needle to go just into the fatty tissue. So it's always good to get your supplies together first. Then you can always wash your hands before you're getting ready to do this. Administering an injection is not a sterile technique, but it's always good to have clean hands when you're mixing the product. So what we'll first do is, from our box, we will remove the 2 vials that we will have. 1 of those vials will have the powder in it. We'll simulate that with this one. There'll be a little plastic cap on the top that you remove. And the other vial will have sterile water, which you can see sort of here that we have some water in this one. And you take the cap off, the little plastic cap off that as well. Another good idea to do is that you will use a alcohol prep pad if you have it, or a cotton ball with alcohol, and you'll just wipe the tops here with alcohol. It's just a good idea whenever you're poking a needle into a surface, whether it be skin or vial, to just clean the top of that as well with your alcohol. Your syringe that you'll have, the 3 milliliter syringe, may have the 22 1.5 inch needle already attached, or then that needle might come separately. Either way, we would put that needle onto the syringe to get started. So we'll need the 3 ml 3 cc syringe with this 22 gauge 1.5 inch needle for injecting. And what we will first be doing is, I'm going to demonstrate a basic mixing method with this, but your clinic will review how much liquid to mix with, and they'll give you specifics. But even seeing my way of mixing is going to give you what you need to know in terms of the mixing. So for the demonstration, what we'll do is we'll mix with 1 ml 1 cc. So what we do is we draw down the plunger and we draw up a little air, and then we uncap the needle, and we first take our vial of sterile water, and we're going to inject a little air into that because there's a little pressure in that vial. So it's nice to kind of equalize that little bit of that pressure in there with entering a little bit of air into it first. If you forget this step, I don't want you to worry. but I just want you to know it's something that we can do, because as I let go of that plunger, it sort of has a little mind of its own and it's moving. But then what happens is eventually that'll all stop and I will be able to have full control over what I'm drawing up. So in this case, we're going to draw down that plunger rim to the number 1 ml, 1 cc. Once we remove that needle, this is extra fluid that you do not need to keep around, and you can put it safely into regular trash because there's been no blood contact with it, so you don't have to put it in your sharps container. Then we're going to take the sterile fluid that we've drawn up and insert it into the powder, tablet, wafer, however you want to refer to that powdered vial, and inject all that fluid in there. At first it'll be cloudy, but then just keep that needle in there, and what you're going to do with that needle while it's in there is just roll around gently. It takes a few minutes to do this step, but just let it take, don't rush it. You just don't want to shake vigorously and create a lot of bubbles with it if you can. You want to kind of minimize all that bubbling effect. Once you see that it looks pretty clear in there, the next step is to turn the vial, or some people say invert the vial upside down. The next little cue that I always give to everybody is make sure to move that needle down as low as you can without having it fall out, because then what you're going to do is pull back on the plunger and drain every little drop that you've pushed into that vial. So 1 ml went in, 1 ml is what should come out. If you're slightly under it, is that okay? Absolutely. But if you're at a half, go back in, because that means you have the other half still left in the vial. So what went into that vial, the 1 ml, as close to that is what you want to remove from that vial, that 1 ml. Then this vial here will, once again, this is also going to now be empty because we've drained everything. So this can go into regular trash. You don't have to put it into a biohazard container. And then you cap the needle that you've been working with for mixing. Here's where there'll be two differences, and I'll show the intramuscular shot first. After we have our ready mixed vial here, syringe, we're going to remove this 22 gauge 1.5 inch needle and discard, and we could open a new package with a 22 gauge 1.5 inch needle that we'll borrow from that new package. In this case, we would simply not use the syringe that came with it, but take the brand fresh new needle that's nice and sterile, because that's going to mean that's going to be good for your injection. This would be the needle that is used for a buttock muscle injection. If I were doing a subcutaneous injection on the advice of my clinic, which they will let you know, and that would be something going into the belly or the upper thigh, then you would be using a much smaller needle. So the only step that would be different is, I'm just going to take this off for a second and set it down. The only step that would be different is after mixing, I would then attach the very small needle to get ready for preparation of the injection. So we'll put that one back into that packet, and I'll come back to that. But I just wanted you to see that the mixing needle is a longer needle, so it goes in those vials, and then you may be switching to a new needle that's longer for a muscle shot, or a smaller needle that might be for that subcutaneous injection. And I'll just move everything away here. And what we're going to do is, this is an injection if we're showing and demonstrating the muscle shot first. Typically, your nurses in clinic may have drawn some circles on the upper outer quadrant of the buttocks, just to show this side here. It's just to show you that the needle's going into that red area. So we're kind of not doing a subcutaneous, which is the fatty tissue, but we're doing into that muscle, that's that glute muscle, and that's a nice big muscle for that. So a lot of times some people have asked if they can do this in the leg. It's usually preferred to give it here because this is a non-weight bearing muscle. So we sort of would avoid sometimes doing the quadricep or the deltoid of the arm, because that's a small muscle. So often you'll see that your clinic centers may be circling this area for you to administer this trigger shot. If somebody, it's recommended with this one, if somebody can, to be administering this to you. And if you were to choose to stand for the injection, what I would do is, if I was getting the injection in my right glute, I would stand with all my weight on the left side, and I could lean a little bit just so that I'm not wobbling. I could put down my right foot, and that person would have a nice relaxed muscle to administer that injection into my right glute. However, if you would like, you could lay down simply, and if I have this mannequin and she were laying down here and I was administering the injection, then by having her lay on her side and I'm administering the shot right here, the muscle's already relaxed. So either way is fine. There is no right or wrong way of standing or lying down. It's just whatever works for you, and that's what we would always want you to do, is whatever works for you. Some people ask if they can put a little ice to the area. For this injection, a lot of the clinics might say it's okay to put a little ice to numb the surface, because you are going a little deeper and that will not interfere with absorption. Or your clinic may be working with you and may have ordered you some Sanera patches, which is a type of numbing patch that you would apply about 20 to 30 minutes before this injection and then remove it to then administer the injection. So if you don't have the patch, it's certainly okay to sometimes, with your clinic's okay, use a little ice just to numb it. If you didn't ice, what I will say is that a lot of times by now you've had several blood draws from your arm. The pinch that you could feel a little bit here is just like a blood draw, even a lot less, because it's not going into a vein, it's just going into your muscle. So I want to give you confidence to know that not to worry about the needle going in, because you've experienced that already with those blood draws. With this, after you do the icing, or if you use a patch, what you're going to do is clean the area with a little alcohol, and then you're not going to pinch the skin. We need to leave it just as is, because we want to get that needle right into the muscle. So the angle that you might see me holding this might look like a slight 45-degree angle to you, and your other hand could be here, wherever you position it that's comfortable for the person giving it. But a slight little angle, so I'm not pointing the needle down toward the floor, and I'm not parallel to the floor. It's a nice little angle so that it's going into the muscle. We don't need to jab with this. If you do see that you have a little bubble in here, or a little air bubble, is that something you want to address? You can give a little flick to the syringe. It usually rises that bubble up to the top. But if it's a real tiny one, I don't want you to worry either, because you're not using this into a vein, and that's when we really want to look for air bubbles. For a muscle shot, it's okay if you had a very small bubble there that just can't be moved, and I can even have that happen to me as well. So it's okay to flick at that to release it, but if it doesn't release, it's certainly okay to proceed with your injection. When you're doing this, like I said, it's a nice gentle angle in and a nice insertion. We do not need to jab. So you place the needle to the skin and then give a little gentle push. If you've iced or used Sanera, you might not feel anything at that point. If you didn't ice or Sanera, you might feel just a slight pinch to that skin, sort of like a blood draw when that needle goes in. The next step is to hold this needle in place and pull back lightly, gently, not a lot, not very far, on the plunger. Why we're doing that is we're just checking to see if any blood enters the syringe. If you've had these areas drawn, it's very unlikely that you will enter a little vessel or a little vein. That's the reason for this check. So I want to reassure you that it's not very common to happen, but when you pull back, if you were to see blood enter here, clinics might do different things, so you follow their instruction, but what we would do is either remove the needle completely if we see a little blood enter, put a little Band-Aid here, change the needle, and go to the other side to reattempt. Or the other way you could handle it is if you see a little blood, you could pull the needle away from the skin, approximately a ½ inch, check again, and if no further bleeding enters, then you could just inject. Either way is how you'll be instructed with your nurse's help in your clinic, but that's just addressing that if you do see blood, you don't want to insert the medication. You want to hold off and reposition, or remove it and go to the other side and reattempt. Either way, eventually you will get to the point where you're not going to see any blood, and you probably won't even see it the first time, and then you'll just inject nicely that fluid, let it all go in. You can do a little count of 1, 2, 3. Remove the needle at the same angle as going in, set it down, and then you just put a little cotton ball there. A little bit of blood will come out, a little bit of the fluid, not a lot. It'll only take 10 seconds of holding this here, not even. And then you might have it where it will stop and it'll have a little pinprick there. And you can apply a Band-Aid if you need to. Just remember you have that there. Don't forget, because it's in the back of your body. Just because Band-Aids, even if you don't have an allergy, sometimes can get you might get a little irritated from that. So you just want to be able to know you don't have to leave a Band-Aid on for 24 hours or anything like that. Just for the quick 10 or 15 minutes, and then you can remove it. If this injection is being instructed by your clinic to take it as a subcutaneous injection, then what you want to know with that is the areas typically that they will reference for you is going to be in the lower abdomen and the top upper or side outer thigh area, because it wants to be in any area where you can pinch a little fat. So using my arm for that, I'm pinching a little bit of fatty tissue off of the muscle. And when you do that pinching, just do a little gentle lift. You don't have to squeeze too hard so that you're not traumatizing your skin by squeezing so hard. You could, with that little shot, subcutaneous injection, you could administer that to yourself, or you could have someone administer that to you. So it's an option. The intramuscular, it's usually recommended if you have someone that can give you that shot, it would be preferred. But with this injection, if you felt comfortable, you could self-administer, or you could have somebody give you the injection. If somebody were to have someone else give them this injection, I usually sometimes recommend that the patient could lay down and you would administer it into her belly this way, because it's a 90-degree angle, or you could administer it into the top thigh this way. Or if we're doing the side thigh, then the 90-degree angle to the side thigh is administering it like this. So it's a 90-degree angle, and if you're getting the shot given to you, then you could lay down. If you are administering the shot to yourself, then you would be in a position of where you could stand or sit, and you would be giving this straight into your belly, straight into the top thigh, and bring it into the side thigh to the side area, like we showed earlier, a little bit of that side thigh. So again, the angle for this one is a straight in, but it's a smaller needle just going 1/2 inch into the fatty tissue. So if we demonstrate that one, if somebody were self-injecting, question might get asked, can I put a little ice here? You could, but it's sometimes it's recommended if you're going to do anything here, maybe to use one of the numbing patches if you have that option, that's ordered for you. But even if you don't have the numbing patch ordered, recommendation is you don't really have to ice these. It's such a tiny needle, you may not even barely feel it. At most, it might feel like a mosquito bite. We all know how that feels. It's a very quick, fleeting pinch. The reason sometimes we recommend refraining from icing with the smaller shots is that you don't want to constrict blood flow. Blood flow needs to be open in the little capillaries to help that medicine be delivered to where it needs to go. So the idea here is just we don't want to interfere with that. The numbing patch won't interfere with that, but the ice, if you leave it on too long, could. So it's best to just know that you really don't need the the ice for this. And oftentimes patients, when I do demonstrate this, they will let me know afterwards that it really wasn't as bad, and I was right, that it felt like a pinch or nothing at all. So I want to reassure you all of the same thing, that it really is something that you won't notice very much when the needle goes in, because it's so fine, that needle. This time we do need to give a little pinch to the fatty tissue. So what you want to know with that is you're giving a gentle little squeeze to the skin, like I said, not a harsh squeeze. You uncap your needle, and then when you have that little pinch of fat, you place the needle right to the skin and just give a gentle little push. Once it's all the way in, you can then push the medication in, nice and gentle. Count 1, 2, 3. Remove the needle, same angle as going in, let it out, and then put a little pressure there. Here, if you'd like to Band-Aid, you usually don't though. If anything, you might see a little clear fluid come out of this opening. So that's the medicine, so we want to make sure we put a little pressure and keep it there, keep it inside the body, but usually not needing to have to do anything with any sort of Band-Aids or anything like that. And then with all of your medications, after you are done with them, when you have this dirty needle and syringe, it goes into that sharps container. So there is no leftover with trigger HCG. Everything you typically mix is going to then be utilized for that evening, that day, or that evening, or that morning, whatever time you're taking this. Your clinic will give you specifics with when you're taking it, how much water you're mixing with. Today's demo was to just show you the demo of mixing, and we use 1 ml, 1 cc, but you might use more, you might use less, or you will absolutely be instructed whether you're taking it as a belly shot or thigh shot, little tiny injection, or whether it will be in the muscle. So I do hope this video has helped you. If you've gotten to this point, I know you have good things ahead, and we congratulate you on getting to this point of a trigger shot, and best of luck to you with the rest of your cycle. And we'll see you back here for some future videos. So I hope that HCG trigger video really helped you to see that it's not so scary, because I think a lot of times, because that's a big shot and everybody hears that or has read that about that trigger shot HCG, they get somewhat nervous. And so hopefully that calmed you down a little bit more to see that a lot of the products overlapped in the way of mixing and maybe administration. But we'll go right to the questions and see if there's anything we can further help you with. If you have any questions, Tony, for me.
I do. So how does the exact timing of my HCG shot need to be? And what happens if I were to miss my shot?
So I think the key with that, as with our clinic and with any of the clinics, is just always, if you're ever having an issue of getting it on the exact time, communicate to your clinic and your nurses. Oftentimes you may not really have to be shifted in the schedule, but what I would say is this is just one that is really important. So I know a little tip that we do is sometimes patients are taking this a little later in the evening, and often a lot of us might go to sleep a little earlier. So we'll sometimes use that little tip of set your, phone alarm, have everything ready, set to go, kind of opened out on a counter, just to kind of help expedite the process of the mixing and then the administration. So I would say this is one of the few that for sure is just a timed injection. So keep that in mind, but there's only one time you take this within the cycle. So it is important, the timing, but if there is ever an issue with the administration timing that you did, just communicate for sure to your team, to your clinic, so that they can advise you accordingly if any shift in your procedure timing needs to happen.
Okay, the next question we have is regarding Abadro, which is, of course, is a different kind of HCG trigger shot. So how does the Hcg differ from the Abadro?
So the Hcg, as you just saw in the video, that is a mixing product before you inject. Hcg does come in a couple different variety strengths. So based upon your cycle and how much Hcg the doctor may feel you need for your trigger, sometimes some people are doing a very small dose of Hcg. So that's why it's good to have the mixing product, because then we can control the dose a little bit. What you'll see with Abadro is a pre-filled syringe with a set amount of Hcg. So it's really nice to have these options, because if that one works fine for you and your clinic uses that, which we use that for cycles for sure, it just depends really upon dosage of whether the pre-filled syringe would be one based on its dosage that works for you, because you can't manipulate the dosage or the strength of the shot. But with the Hcg, that gives you the option if a patient needs either a lower injection dose or even a higher injection dose. And that's what's offered by doing the mixing product like the Hcg that I just had shown. So really the different varieties are just nice because it's an opportunity for the doctors to sort of tailor those cycles. But the idea behind those products is they are all delivering the same ovulatory trigger and preparing for final maturation of the eggs, which is the ultimate goal of all of them.
I know Wanda mentioned earlier that we do have a lot of abbreviations in fertility. So the next question is, how do I know if I have a case of OHSS, which is ovarian hyperstimulation syndrome? Even I get like tongue-tied with these. And what steps would I take if I thought I had that?
Okay. I know some patients read about that and do get somewhat nervous before they start their cycle. So just to let you know, severe cases of OHSS are less than 1%. So the percentages are rather small for even just a slight case of OHSS, which could be around less than 5%. But really severe OHSS is less than 1. So this OHSS is not all that common. Most ovaries are mildly to moderately stimulated, but some people can just get a little bit more symptomatic than other patients. So something of what you might feel is you might feel a lot of pelvic or abdominal tightness, a little of bloating, some pressure. You might not just feel crampy, you might feel pain. You might step on the scale and go, geez, I feel like I weighed myself yesterday and today I've gained 3 pounds. You might feel like you're not urinating as much, or you might have just a little like feeling like you can't take a deep breath, a little shortness of breath, or maybe even a little nausea, etc. So if you ever have any of those symptoms, oftentimes we will tell you, contact the office. Most often OHSS that's mild to even teetering a little bit moderately is very well managed by visits to the office, doing some ultrasounds, really drinking lots of fluids is going to help. We sometimes will check additional blood testing just to check in on that as well. So usually it's manageable with time and with management of just being able to be reassured and seen in the office. But I think the biggest take home I'd want to say is if you feel something that just doesn't feel right and you think, oh, I guess this is normal, always if your gut is telling you to maybe question it, then question it. And always we'll guide you with what we need to do on our end as the clinic in terms of bringing you in to be monitored, so that we're there to support that and offer you support that you you need.
All right, I think that kind of wraps up our questions for tonight. I don't see anything else coming in. So I don't know if you have anything you want to close with, Wanda, before we say goodbye.
Sure, I'll do a quick close. I was just looking at something that I have here. I am a certified healing touch practitioner, which also works with energy of the body, the energy centers. And I think that fertility is stressful. I think that these medications feel stressful. So I always like to just give you something that, you know, might help you through your journey, might help you to think about how best you can handle that. So one of the things I had is I was just looking at my little card, which is practicing gratitude. And I read a little sentence here that I like, or I'll read this sentence where it talks about gratitude shifts our perspective from what we lack to the abundance we already have. And so I think that when you're going through fertility, the ultimate goal is pregnancy and family building, but there's a journey in getting to that point. And sometimes we can get a little caught up in the stress of it, the stress of the cycle. So I wanted to just add that practicing gratitude can allow us to take a challenging situation and own it rather than the challenging situation owning us. And what I mean by that is imagine yourself as you start this cycle as already having completed your fertility cycle, as having gone through that retrieval successfully and that transfer, putting yourself in the place of where you actually want to be in a visual. That can be really helpful rather than resisting each of the steps along the way, which creates more stress and creates more anxiety. Letting yourself be in that place of gratitude for what this journey is supposed to teach you as a couple, as an individual, it'll bring you into a better place of calm and letting go. So lastly, if we allow ourselves to express gratitude for this fertility journey, the learning we achieve will give us a sense of strength and empowerment and peace. And so that's what I just want. I think we can all use a little bit of that gratitude, but how to apply it with fertility is sometimes just not letting it trip us up and create more stress. Lean into it. Know it might be a challenge, but with every challenge, you do get stronger on the other side. So I thank everybody for tuning in with us tonight. I appreciate that you guys hopefully were able to have an opportunity to learn with the medications, the mixing, the administration. And a reminder is, I'll let Tony finish up with some final remarks, but I send each and every one of you all the very best in your fertility journey and wish you all the peace and calm and strength that you need to get through these medications.
Thank you, Wanda, for being here tonight and joining us and answering all our questions. We do pride ourselves on hoping that you learned something tonight. If you didn't ask a question, we hope that we answered something for you. So thank you to everyone that joined on Zoom, Facebook Live. All of these videos you can refer back to. They're on our YouTube page, our Facebook page, and then the mymandells.com pharmacist page. So truly, the more and more you watch these and see these, I know when you get that big box, it's like a ball of anxiety. But lean on your clinic, lean on your nurses, have gratitude, and just know that the more you see these things, the easier it will become, and you will be a completely different person on STEM Day 12.
Absolutely, absolutely.
We look forward to seeing everyone here again next Monday night for another great program. I do want to share a little tidbit. This Wednesday, October 6th, we are going live at 7 p.m. on the Mandell's Facebook page, and you can also check out the flyer to get the Zoom link if that's easier. But we're going to have our first live nursing panel discussion. The title is going to be Fertility 101. So I think this is a really good chance for people that are new into the fertility journey, even some new nurses that are out there, for y'all to get on, ask questions, just listen to the nurses discuss anything and everything from fertility. So join us on Wednesday for that. Otherwise, we'll see you again next Monday at 7 p.m. Eastern. And then please just get the word out there and share the pharmacist program with anyone you think could benefit from it. And we thank you guys for joining us. We'll see you next week. Bye.
Thanks, Tony. Bye, everybody.
Bye.
Have a good night.
You too.